Communicating with your doctor is one of the most important elements to getting the best possible care for hereditary angioedema. I'd like to share with you a few pointers to help you get the most out of your doctor's visits. First, understand it may take some effort to find the right doctor for your condition, your needs, and your personality. Also, recognize that you have treatment options for your hereditary angioedema. Be sure to get information about these different treatment options, whether that's from the HAEA or your physician directly. Next, consider your treatment options and discuss these with your family, your friends, or any other people that are involved in your life. Once you're going to discuss this with your doctor, be sure to organize and write down your questions so that you can make the most efficient use of your doctor visit. Now I'd like to give you a few tips on what to be sure to include when you see your physician. First of all, make sure you have your medical records available. Your doctor will want to review these, and it's important that you present these in an organized fashion. Second, be clear about your personal goals and expectations for treatment. Your doctor will best be able to serve you if he knows exactly what you hope to get out of your HAE management plan. Next, be sure to get your personal questions or concerns addressed. Sometimes it's helpful to write these down ahead of time so that you don't have to think about them at the time you see the physician. Also, be sure to tactfully but confidently assert your feelings about which therapy is best for you. You need to understand as well that your doctor may need time to gather information or to pursue the treatment that you request. These HAE treatments are complicated, and many physicians will need some time to gather the proper information. Also, be willing to do your part of the legwork to arrange your treatment plan. This may involve paperwork, phone calls, or notifying your local hospital. In addition, talk with your local treatment location. That could be a doctor's office, an emergency department, or maybe a home health care nurse. But be sure to discuss your condition and your treatment needs with those that will be involved. Also, I'd like to give you a few tips on what not to do when you visit your physician about your HAE. First of all, don't expect the healthcare system to automatically be prepared for your treatment needs. HAE remains an uncommon condition, and so many hospitals or offices are not automatically prepared to treat your condition. Secondly, don't expect your doctor to fix all past difficulties. We know that many patients with HAE have had trouble with the healthcare system, but try to leave that in the past and move forward with the new and better advances we have for HAE. Also, don't bring a large stack of printouts from the internet. While it's okay to bring a few pieces of information you have questions about, your physician won't be prepared to go through large stacks of paper with you during the time of a visit. Please don't underestimate the complexity of treating HAE. This is a complex medical condition, and many details are required to both acquire the medication and also arrange the treatment details. In addition, it's important to monitor for side effects from any treatments you use for HAE. So this will take time, and it is a complex process. And finally, don't be alarmed if your physician wishes to get input from other specialists. This is actually a good sign, as it means your physician is interested in getting the best possible information and providing the best care for you. I'll wrap up by saying, remember first of all that you're your own best advocate, but your physician is an essential partner for successful management of HAE. Be sure to find a good match for this partnership. You know your situation and your medical needs better than anyone, and your physician values this information, but it should be provided clearly and concisely when you communicate with your doctor. Treatment plans for HAE require teamwork, and by following these few tips, you can plan as efficiently as possible to set up your plan.